there, everybody. Welcome to Monday, May the 17th. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Here to give you our Monday 2:30 update on Facebook Live about the impact of the COVID-19 pandemic on Mobile County, and talk a little bit about some updated guidance and about our vaccination efforts. So worldwide, we're over 163 million cases of COVID-19 with 3.4 million deaths. Sorry, we're making a little adjustment to the microphone here. In the United States, we're creeping up on 33 million cases of COVID-19 with over 580,000 COVID deaths. In Alabama, just over 540,000 cases of COVID-19 with just over 11 million deaths. And in our daily report today, we're reporting on a total cumulative number of COVID-19 cases reported as 41,331. 11 were reported to us yesterday. You can look at those figures in our daily report and in our weekly expanded report to see that we are still seeing a very low number of COVID cases transmitted each day. The cumulative number of patients hospitalized with COVID-19 is at 4,971. 5 additional hospitalizations were reported yesterday, but again, the number of people hospitalized any given day with COVID, thankfully, has dropped back down into the 20s. So we got as high as 45 about 2 weeks ago, but we are seeing a decline after an increase due to the gatherings that occurred around Easter and spring break. And the cumulative number of people who have died with COVID and reported to us is 809. If you look at the expanded weekly report, again, we give a lot more information on that report. You can see that for the last 3 weeks, the number of COVID cases reported to us, this includes confirmed and probable cases, it has gone down each week for the last 3 weeks. So we saw that spike the week of April 18th that was likely due to gatherings around Easter and spring break. And now since then, we have seen a steady decline in the number of COVID cases reported to us. So this is really excellent news, just to celebrate that those, take time to acknowledge and celebrate that those cases are coming down, which is really good. Hopefully that trend will continue, even though we have some loosening of restrictions and increase in gathering. You know, we're hearing about graduations and proms and outdoor events and all kinds of things that are starting back up here coming up on summer. So we're hopeful that with the vaccine and continued adherence to, masking and distancing in those high risk situations, indoor settings, large gatherings, that sort of thing, hopefully those numbers will stay down. The number of patients hospitalized, as I mentioned, has been decreasing over the past couple of weeks, and the number of deaths attributable to COVID have been quite low. Last week, just 1 death. The week before that, 3. The percent positive rate, so this is a figure that we look at very closely. It is still quite low, less than 5%. But we are still seeing outbreaks. We have COVID cases in nursing homes and a detention center, and we have clusters of cases that are occurring in schools and in daycare settings. So we still have a risk of COVID transmission out there. So please continue to be vigilant. Get vaccinated if you're not already vaccinated. If you elect not to vaccinate, which there's really no reason not to avoid a very safe and highly effective vaccine. But if that is your personal choice, please continue to wear a mask and socially distance when you are outside of your household. So just a little bit of information on vaccination coverage. So I just looked at the data hub before walking in here. It was last updated on May 17th, I guess, which was today. And in Mobile County, among people who are 16 and over, the percent who are fully vaccinated is 37%. So that is extremely low. a lot lower than we would like to see it at. And what's happening is we're still seeing low uptake among those younger populations. So if you look by age category, we're actually reaching that holy grail of 70 to 80% immunized. So if you're in the age group in our population that's 75 and older, 69% of them have been vaccinated. If we look at 65 to 74, 67% have been vaccinated. So those are really good numbers. We're really excited about that. And as we start to try to reach, homebound individuals, to reach people who have just been too ill to get out of their houses to come to a vaccine clinic, we hope to see that percentage inch up ever so slightly, but really, really good coverage. But it's when we start looking at the people less than 65 where we have a lot of work to do. So in the 55 to 64 age group, less than half are vaccinated. So remember that, the older you are, the more comorbidities you have, the more underlying medical conditions that you have. All of those things put you at higher risk of severe disease, complications, and even death. So we need to get this age group 55 to 65, we need to get you vaccinated. So please, there's plenty of vaccine out there. You can get it at all kinds of pharmacies, at big box stores with pharmacies, at small grocery stores in their pharmacies, and lots of drive-up events. You can get it any day of the week now at the Mobile County Health Department without an appointment. So you can just walk in to our New Bern clinic any day of the week and get a vaccine. So please, we're trying to make it as convenient as possible, taking it to schools, taking it to churches, taking it to outreach centers, community centers, trying to get the vaccine in the arms as close to the people as we can. So we really need, if you're in that 55 to 65 age group, please take the time to get a vaccine as soon as you can. And then for people who are under 55, this is where we have the largest the most work to do in getting people vaccinated. So the data that are on the hub, on the data hub, show for Mobile County, people between the ages of 16 and 55, less than 24%. So 1 in 4 people who are less than 55 have been vaccinated. And we need to change that to be 3 out of 4 people. And vaccine coverage, as you know, has been extended for the Pfizer vaccine. People aged 12 and 15 are now eligible for a Pfizer vaccine. So opening up, adding those people to our mix, it's going to mean that, in that age category less than 55, even a smaller percentage of those people will have vaccine coverage. So please, that if you are under the age 55, please give us a call, reach out, try to get your vaccine. Sometimes it's just an inconvenience, but now is the time to make the accommodations that you have to do to get vaccinated. We have plenty of vaccine. There's no concern that we are going to, that vaccine shortages are going to be in low supply. We have plenty of vaccine out there. We know that there are people really interested in getting vaccine. Sure, the numbers have dropped off from our very early vaccination clinics where we would have sometimes several hundred people. I think in total, at least at our health department, we vaccinated around 400 or 500 people last week. So, and we're opening up more and more clinics in more and more locations to make it easier for you to get out and get a vaccine. So, keep in mind that the loosening of the mask mandate is for the CDC recommendations that, you don't have to wear a mask. Those are, that accommodation is for a fully vaccinated person. It's not for everybody. So yes, there is no mask mandate, although it is really important that if you are not vaccinated, that you continue to wear a mask and physical distance and stay at home if you're sick, for everyone, to try to keep COVID transmission low. So remember, fully vaccinated person is that for at least 14 days has passed since your second dose of Pfizer or Moderna, or since your first dose of J&J. If you've had that last shot and 14 days have passed, then you are considered fully vaccinated, and you can in most situations, return to what you were doing, how you were living your life before the pandemic began last April. So that is really good news and extremely good incentives. Only 12 and over can get vaccinated. So people less than 12 years old, kids, children, they right now cannot reach that fully vaccinated person status. So parents, please get vaccinated to protect your family, including your children, and please continue to have your children wear a mask when they're out in public or in school or at any gathering. So there are some Q&As around what you can do if you're fully vaccinated. Here are some questions, some exceptions to leaving your mask at home if you're fully vaccinated. If you have a condition or taking medication that weakens your immune system, you may not have reached the peak of protection from your vaccine. So you may need to continue taking precautions like wearing a mask and distancing when you are outside of your home at an indoor gathering or at a large outdoor gathering. See, if you're in a community with lower vaccination rates and high rates of disease, you may choose to still wear a mask. So, less than 24% of people under the age of 55 have been fully vaccinated. So if you're mixing in gatherings that have those younger age groups, remember that there is a low percentage of fully vaccination protected people in those age groups, which means there is a higher risk of COVID transmission in those age groups. Here's another one. What about masks in schools? So right now, school guidance remains unchanged, and this includes students and teachers and staff. So teachers, school administrators, and staff that are fully vaccinated should continue to follow CDC's school guidance until more children are vaccinated. I know school's going to be out in a couple of weeks. My nephew knows exactly how many days there are until summer vacation, but until then, please continue hypervigilance to protect students. So here's a couple of questions. Someone asking about the latest on parks and youth sports. So, CDC has said that for people who are fully vaccinated, there is just so much evidence to show that you are protected from severe disease, hospitalization, and death. If you do get infected, you're unlikely to transmit it to others. These are all the really good reasons, really good, strong immunity. The vaccines work against the variants. So that all of those things kind of led to saying if you're fully vaccinated, going outside in an open park, it is perfectly safe. But it's not the same for youth sports and youth events, particularly if they are in children under the age of 12, or if they're in 12 to 18-year-olds that don't have a high proportion of those students who are fully vaccinated. So it's still risky to get a group of kids together, indoor, or outdoors, if they're not fully vaccinated. In those situations, you should still continue to distance and wear a mask and cohort to the greatest extent possible. I really hope that band leaders and coaches and teachers and administrators in schools will advocate for vaccination for school-age children and all staff that are eligible so that we can protect the kids who are not yet eligible to receive a COVID vaccine. Another question asking about non-residents, undocumented residents of the United States, are they eligible for vaccination? And the answer is yes. We have enough vaccine now that we will vaccinate anyone who presents to us for a vaccine. So you don't have to show a driver's license or documentation of citizenry or any citizenship or anything like that. If you want a vaccine, we have vaccine available. We will vaccinate you. All right. So now on to just... Two
questions.
Okay.
Do private doctors' offices have the vaccine?
So the question is, do private doctors' offices have the vaccine? Some do, but not all. So the best course of action is to visit vaccinefinder.org to see if your private doctor's office is offering the vaccine, or contact them and ask them. The vaccines, some of them are delicate, and some providers we are hearing are opting not to vaccinate because of the sort of all of the work that has to be done to make sure it's stored properly, that you have to give every dose once you open it. I mean, there are just a lot of tricky things about it. And so we know that this has been sort of a difficult administrative burden to take on, logistical burden to take on. So not all providers, but you'll just have to contact yours to find out. But having said that, there are plenty other places to get vaccinated around town. So don't let the fact that your private physician, if they've elected not to offer the vaccine, please don't let that stop you from getting your vaccine. Call us, 690-8889, and we will get you in.
Why is the Southeast so high at hesitancy of getting vaccine?
Yeah, so the question is, are there explanations for why people in the Southeast are hesitant? I think that there is vaccine hesitancy across the United States, and it does vary geographically. For a lot of reasons, for political reasons, like sometimes people's political beliefs cause them to question the government or media messages, and sometimes that causes them to be more hesitant to take a vaccine that the government funded. So I've heard some of those reasons for not wanting to get the vaccine. Often, particularly in Alabama, there is understandable mistrust of the healthcare system for some atrocities that were committed long ago in Alabama institutions. And so that leads to vaccine hesitancy. And we're working hard to overcome. Sometimes people just say, I just don't have time, right? And so we're like, please try to make the time and just talk to people and understand what their fears are, what their angers are, what their barriers are. And at the health department, we just try to do what we can to lift those burdens, or to lift those questions, or to lift the fears and angers, and try to get as many people as possible, to go and get a very safe and effective vaccine.
How do you know if a person is fully vaccinated?
Yeah, so the question is, how do you know if someone's fully vaccinated? And this is something that we're all grappling with. When we first started encouraging people to distance and wear a mask, there were some people that just said, I'm not going to do it. The government can't tell me what to do, and I can be safe on my own, and I'm just not going to do it. So now we are asking people, most of us have been wearing masks, and we're saying, okay, some of you can take it off. The others of you must leave it on, or should leave it on. And there's really no good way to tell when you're in public. Now, with your family, with your friends, with your church, with your congregation, with your golf buddies, I hope that you have enough trust and communication with them to say, hey, are we all, fully vaccinated here? If so, we can, play this nine without our masks, and we're outside and we'll be fully safe. But I realize that that's sometimes asking someone if they're fully vaccinated offends them, because it's perceived as being kind of in their business or being nosy. So these are challenging conversations to have, but I think that it's worth having an open discussion. In workplaces, it's actually, if you ask a coworker if they're fully vaccinated and they say no, it's actually against the law for you to ask why not. It's an EEO situation where, you can't ask them about their protected health information, or you can't ask them to divulge information that is not a requirement of their job. But asking if they're vaccinated is okay, is the way I understand it from our attorneys. So these are, I have a friend on Facebook, who said, why does everybody keep asking me am I vaccinated? I'm so tired of it. And I said, because we want to know if we can hug you. We want to know if we can come to your birthday party. We want to know if we can invite you to, our Memorial Day party. And that's why we ask. And so just try to, treat everyone with kindness and understanding. My personal feelings are very strong about vaccine. I have very close family members who are feel strongly against taking the COVID vaccine at this time. So we continue to talk about it and try to find some common ground. And that's all I can encourage you all to do out there. It's unlikely we're going to have a big button or a passport or something like that we'll be able to show to prove that we're vaccinated. All right, let's see. A couple of vaccine events that are going on this week. So, this is a big one for us. So, we announced that last Tuesday, in an effort to better serve our community, our COVID response team began giving COVID vaccine at our Newbern Health Center. And now, starting today, along with offering the vaccine, we'll also provide walk-in rapid testing weekdays 9 until 3:30. So at the Newbern Health Center, located at 248 Cox Street, Monday through Friday from 9 a.m. to 3:30 p.m., we will offer walk-in COVID vaccination and walk-in rapid testing. Free to the public, no appointment necessary. We're not going to run out of tests or vaccines. So just come on down. We're starting to see a lot of people who need evidence of a COVID negative test within a few days of travel or maybe returning to work or something like that. So we are able to assist you there. And don't forget that we still provide walk-in rapid testing at our Keeler location on Wednesdays and Fridays. All right. And I should talk about the family health vaccine, right?
And the Bel Air Mall tomorrow.
Oh, yeah. Oh, Mark's reminding me that we tried a new location last week, and it's working so well, we are going to do it again. So last week, 2 days, we were at the shops at Bel Air, set up in the parking lot at 3299 Joe Treadwell Drive. So it's basically at the corner of Airport and Bel Air Boulevard, kind of next to the Wendy's that's there. And so we had our van there last week, but I think this week we're going to try it just as a drive-through. So on May 18th, that's tomorrow, we'll be there at 1:30, from 1:30 to 5. We're trying to hit that, 3:30 to 5 period so that kids can come after school. People who work can maybe just take off 30 minutes or an hour early to get by there to get vaccinated. So again, this is tomorrow, 1:30 to 5. Drive-through. It's going to be a Pfizer event, so anyone 12 years and older are eligible for vaccination. Just drive on up and somebody will tell you where to park. All right, we're still doing vaccine. I think it's Moderna vaccine on Tuesdays and Thursdays, and that's at Newbern. Okay, so we have our walk-in clinic at Newbern. We have our drive-up at Bel Air Mall. So if you want an appointment, then in order to get an appointment to get vaccinated, and these are all Moderna appointments, you need to call 690-8889 to get an appointment to get vaccinated. So I think that's about it. First Baptist Church Street. So also tomorrow, this will be in the morning, 9 a.m. to 12 p.m. For people who received their first dose of Pfizer on or before April 27th, you can come get your second dose at First Baptist Church of Mobile at 806 Government Street. Again, enter via Jefferson Street. Remember to bring your vaccination card. All right. Anything else? Okay, I'm getting the thumbs up. So, again, just lots of vaccine out there to be had. Please stay tuned to mchdcares.com or call us at mchd 251-410-MCHD to find out about our latest clinics. We often have pop-up clinics here and there, so stay tuned. Stay tuned in to our Facebook, our Instagram, our Twitter, and our website to see when We have new clinics that are added, and we'll come back and speak to you again next Monday to bring you the updates. And if something happens before then we might have another impromptu Facebook like we did on Friday at Art Walk. So have a great week, everyone. Stay safe.